like I said before, we have always dealt with viruses, and we've dealt with them in a good way. We were not afraid. We did it without fear. We dealt with viruses without people losing their jobs. But what has happened today is that this COVID pandemic has turned into a political nightmare. What have we become as a society and as a country? And I would ask everybody to think hard of that. Is that the way it should be? It should concern everyone. It is my job as a legislator to make those tough decisions. And I'm happy to make them all day long. And yes, sometimes they could be tough. And you have to go back to your constituents and explain why. But that's our job. That's why we were elected. To let the governor make these unilateral decisions without the input from the legislature, without giving us the opportunity to vote on, is just wrong. We can do our job. We can take votes on whether or not masks should be mandated and whether vaccines should be mandated. I think everybody here is pretty clear, knows where I stand on those issues. But I just want to review, what have we accomplished in the last 18 months? So yes, Connecticut has one of the highest vaccination rates. People who chose to get a vaccine, that's great. They went out and did it, and we have, I think, the second highest. But Connecticut also has the lowest infection rate. But Madam Speaker, let me explain to you what else has happened in the state of Connecticut and here's what else we have accomplished, and it's really scary. It's startling. It's very, very concerning. So over the last 18 months, because of a one-party rule, here's what we've accomplished. Depression has increased. Suicide has increased. Substance abuse has increased. Juvenile crime has increased. Thousands have become unemployed, and that number is rising and is going to rise due to the vaccine mandate. Children in school are not learning to their full potential because sometimes they had to remote learn. They can't function and pay attention in class because they have a mask on all day. They're coming home with headaches. They're not feeling well, which has affected their learning. They're having a hard time breathing. Some of our children cannot play sports. Families unable to freely see their loved ones in a nursing home or a hospital because there are so many strict rules. Family members passing away and dying, and they're not unable to see them. It's heart-wrenching. We have come to a time where we are segregating our communities. We are discriminating against people. This is what we've accomplished in 18 months. Think about it. This is everything that has been done in 18 months. Businesses have been closed. Some businesses are now mandating vaccines for their employees. Hardworking individuals that have worked for decades for their jobs are now going to lose them. Landlords, landlords are unable to collect rent, which is now they can't pay their mortgages, which is forcing a foreclosure. This is what has happened in the last 18 months because of a one-party rule. This is what has happened because of the state's response to COVID-19. It is true that the cure is worse than the virus itself. And this will continue until we are back to normal, no longer in a public health emergency. It's not warranted, Madam Speaker. We need to get back to normal. People want their lives back. I could sit here and probably go on for another hour or so about what the effects are that this public health emergency and civil preparedness emergency has done to our state. It's really sad today that people do not trust our government. They don't trust the medical community. I am getting constant calls from constituents that they are very concerned about their livelihood. I haven't gotten one phone call, have not received one phone call or one email that people saying to me, you need to extend this emergency power. I want to be under the control of the state of Connecticut. I don't want you to do your job. We took an oath of office, Madam Speaker, to uphold the Constitution of the United States and the Constitution of Connecticut. And it is our duty as a body, as a legislature, to do that and make those decisions. I sometimes wonder why people stand up and take that oath of office if you're not going to fulfill your obligation to your constituents. But I can tell you a yes vote extending these emergency powers today sends a clear, loud message to your constituents in your town that you are not able or willing to do your job and make those tough decisions for the constituents that elected you. Madam Speaker, I would urge, obviously, all my colleagues to vote against this extension. It is not warranted at all. There is no public health emergency. Any emergency that happens, this body can convene in no time at all. There's no sabotage, there's no disaster for civil preparedness. It is absolutely not necessary. Just think about it, going another 6 months, 6 more months. How much more damage are we going to cause to the state of Connecticut? Madam Speaker, I will leave it at that. I know there are a lot of members of my colleagues here that do have a lot to say, and I'm sure they will certainly give you an earful. But I certainly would encourage the members of this chamber to vote no on extending these powers. And let's do our job and give the power back to the people and back to this body of government. Thank you, Madam Speaker, and thank you to the good Senator Fox. Thank you.